Honor now to introduce my good friend, Dr. Hugo Ocampo from Colombia, South America. Uh, we have not met physically, but we've interacted. We've done some talks for their ocular trauma series that he's been doing. And he and his team have taken the series of doing monthly education or weekly education over several months to really cover various aspects of ophthalmic trauma, involving speakers both from the South American continent and the rest of the world. And to introduce Dr. Hugo Ocampo, I have Professor Caroline Chi, our treasurer of APOTS, to say a few words.
Thank you, Ganga. It's my great honor to introduce Professor Hugo Ocampo.
Caroline, we can't hear you.
Can you hear me now? Can you hear me?
Yeah, loud and clear.
Okay. It's my great honor to introduce Professor Hugo Ocampo, who is the professor in retina and ocular trauma of the Universidad de Valle in Cali, Colombia. He is also the former president of the Colombian Association of Retina and Vitreous and the former president of the Pan American Association of Ocular Trauma. We are looking forward to his talk, which is Ophthalmic Trauma, a Latin American perspective, strengths and weaknesses.
Hi, thank you very much, Dr. Okay, can you hear me?
Yes.
Okay, thank you very much for this kind of invitation, especially to Ganga and Dr. Ayan. And I'd like to share with you this presentation about ocular trauma in Latin America. Okay, I want to share about the bad, the good, and the ugly in our continent. This is Latin America. Latin America goes from Mexico to Patagonia in Argentina. And of course, I have many cases of ocular trauma. Fortunately, we have an association of ocular trauma is APTO, is Pan American Association of Ocular Trauma, is APTO in Spanish. I like to show about the bad in our continent. The first is, of course, ocular trauma is one of the main causes of ocular trauma in our countries. Without COVID and with COVID, of course. This is a picture from me in my office with the fellow checking on patients with ocular trauma. And I'd like to show some statistics from some countries in Latin America. This is numbers for Guatemala in 1909. You can see in 1 year, 5,433 patients is main, almost 15 patients per day with ocular trauma before COVID. Chile, in between 2016 and 2019, almost 31 patients per day before COVID. After COVID, the numbers don't change a lot. 43 patients per day is only because it's the Jan to March, this statistic. In Colombia, here, before COVID, we have in this almost 1,000 patients, and the maybe 60% of legal blindness. And after COVID, here in Colombia, this is the register and our hospital in the Bay University. In 9 months, we have, February to October, maybe 1.1 case per day. In the statistics the same, the majority is for male, and almost 20% is penetrating trauma in this moment, in 2020. So the balance before COVID and after COVID is almost the same here in Latin America, almost in three countries, okay? But this so difficult educates the population about the protection. This is a few numbers about the register of Latin America trauma, and you can see that 100% of the patients with ocular trauma don't use any protection in the moment of the trauma. We know the education is the most important part, maybe in the management of many diseases, even in ocular trauma. What is the good things with us? I talk about the APTO. APTO is a child of Pepe Dalman. This is some of the people that work in ocular trauma in different countries, Chile, Guatemala, Ecuador, Peru, Argentina, Colombia, and of course, Mexico with Pepe Dalman. APTO, born in 1995, this is the original paper that Pepe wrote about his idea. And in this moment, we have 1, 2, 3, 4, 5, 6, 7, 9 presidents, and the next president will be Carlos Juan from Peru in this year, 2021. APTO has a mission is to educate the people in all continent. And the good is that we have the same ideas in ocular trauma management that Ferenc could teach for us. This is a very old picture, maybe 10 years ago. I was here. Is Pepe, is Ferenc, maybe in American Academy of Ophthalmology. And the idea is to transmit the patient for the ocular trauma. This is Felipe Morera from Chile, and she is Dr. Wendy Reyes from Guatemala. The idea is to could transmit the patient, the managed trauma, about the ISOT ideas, up to could these ideas and transmit the same message. 2008, I made the first international ocular trauma in Cali, Colombia, with Pepe and Ferenc. And Felipe Morera is one of the most enthusiastic doctors in this moment in Latin America in the ocular trauma field. Felipe made the first Latin American meeting in ocular trauma in Chile in July the last year. But after COVID go all the world. But again, Felipe Morera organized a beautiful online meeting, was pole to pole, the Polo Apollo, in June the last year. And again, we could to show, to teach of many people around the world with the magic of internet, ocular trauma management. This is the picture of the all people that work in ocular trauma. And recently, we organized a beautiful ocular trauma course. The idea was made maybe 100, 200 people in this ocular trauma, but was a beautiful experience because we can't share to 21 countries and 37 speakers around the world. And we made this course every Saturday at the morning Colombian time for 3 months. We could have in average 5,000 people, even 8,000 people on Saturday in this ocular trauma course. So we created an application for ocular trauma management. This application has the OTS app. What is the idea of the OTS app? It's just translate the OTS, the beautiful tool that Ferenc created for some time, 2009 maybe. And if people that has this application could calculate the OTS and can find the people that work in ocular trauma, the closer place that the practitioner or the general doctor use this application. What is the idea with APTO? Is teach the proper trauma ocular management to colleagues in Latin America. This is the kind of surgery that we teach in our meetings, is try to do the surgery on time. And this is one of the cases that you usually do from Mexico to Patagonia, is do the surgery in just one time, or at least teach the people to close the eye in the best way and teach the signs of alarm. That's, for example, this chemosis that showed penetrating ocular trauma. And this is the kind of story that I try to teach to our doctors in Latin America. Okay. What is the ugly? Of course, I know that we have extensive experience in ocular trauma management in Latin America, but we publish very little, and we don't have the culture to publish so frequently. And moreover, it's so difficult to obtain a budget to investigate in our country because we have another needs, and maybe the possibility of obtaining budgets is very difficult. However, you know that what is published doesn't exist. So we need to try to publish more, but we need more budget to obtain that. However, we have many good things. For example, in Chile, the state Chile covers up 100% of severe trauma in many cases. Guatemala with Wendy Reyes create an exclusive clinic for the management of ocular trauma. In this moment for the pandemic, this clinic of ocular trauma is closed, but we hope that maybe reopen. Mexico, Pepe Dalma recently created an eye trauma clinic with the same idea of Wendy in Guatemala. Here in Colombia, in January 15, I mean the next week, we will start the Retina and Ocular Trauma Fellow. It's 18 months of training of ocular trauma. And APTO created recently the PETIT. Who is PETIT? Sorry. PETIT is the Pan American Eye Trauma Investigation Team. We want to work more in publication, in investigation, to share with the rest of the world the kind of management that we offer here in Latin America. So I think the 2020 or better 2021 is probably very likely to be the same as 2020 in terms of pandemics. In this year, last year in 2020, we learned to use virtuality as a very good tool. The distance were abolished. And I think that we can work as a single global ocular trauma group with these tools. Okay, this is my family. You see a place called Chia in Colombia, and of course with Max. I want to say thanks again to Ganga, to Natarajan, and all people who thank you very much.
Thank you, my friend. I think you're doing a lot of work in South America, and I think every time when I was invited to Bogota somewhere, I got stuck. I hope, I think 2-3 years back also I was invited to Cartagena, and I'm still yet to come. And I think all the invitations are postponed. I don't know when to come. One day I'll come. But I think wonderful. Your PETIT program looks wonderful. Let me know how we can actively take part with you from this part of the world.